Entrepreneurs succeed by responding with great speed to pressing needs, and this next group of changemakers are doing just that. Join this discussion to learn about how innovative and inspiring businesses are rebuilding a new economy with tangible health solutions and playing a vital role in achieving the SDGs.
Hello, everybody, and welcome to this SDG Action Zone event hosted by Accelerate2030 and Impact Hub. It's a great pleasure to meet you today. I'm the moderator. My name is Flora Rosenow. I am the Brand and Communications Director of the Impact Hub Network. And if you haven't heard about the Impact Hub Network, we are a global network focused on building communities for impact at scale. So we do that within 100 communities around the globe, having more than 16,000 changemakers within our communities that spans across 55 countries in all of the 5 continents of the globe. With that, we are one of the largest communities and accelerators for positive change. And we build ecosystems that drive collaboration and also entrepreneurial innovation around the sustainable development goals. And we do that through locally rooted impact hubs, as well as through partners and allied networks. So with that, we are here and we are very pleased to be joined by Pradeep, Kakkattil, the head of innovation of UNAIDS, also one of the main partners of Accelerate2030. Then Laura Mendoza from Unima, founder and chief product officer. Rafael Figueroa, portal Telemedicina, chief human resources officer, and Diana Carolina Quintero, co-founder and CEO of Bive, or Bive, sorry. All of these speakers today are part of our Accelerate2030 community. So if you haven't heard of Impact Hub, you may also not know what Accelerate2030 is. So let me give you a little introduction. It's actually the largest program that our network is doing, focused on entrepreneurial action to achieve progress towards the Sustainable Development Goals. So very much in line with our overall mission. It's a global multi-stakeholder program, and the mission is to support entrepreneurs from developing countries to scale their solutions. We initiated this in 2016 together with the United Nations Development Program, and we were very strongly and still are supported by the International Trade Center, Pfizer, as well as the Swiss Development Corporation. If you're looking at Accelerate2030 in numbers, we brought you a few slides here. You can see that to date, we have implemented 3 cycles in about 26 countries. They are spanning from developing to also emerging economies in Africa, in Asia, in Latin America, as well as in Eastern Europe. And in total, we have reached 2 million people so far and engaged 1,500 entrepreneurs and 50 partners globally. If you think about that, about across the circles, here are some numbers regarding our companies about the cohort from last year. And what you can see there is that the entrepreneurs supported through this program have reached an impressive growth when it comes to the impact metrics, as well as the amount of beneficiaries they have reached. So nearly 200% increase, as well as new markets reached. So with that in mind, this is a good program, but what only makes and breaks this program are the amazing entrepreneurs and partners behind that. And these are the people joining us here today. So the topic is focused on SDG 3. Good health and well-being. And while some of you may be experts on this topic, others may actually be new to this conversation. And so what I did is I brought you 2 key statistics provided by the UNDP just to get us a little bit started in this conversation, to get us comfortable. So the first one, at least 400 million people have no access to basic healthcare, and 40% are lacking social protection. The second fact I'm bringing you today is that more than 1.6 billion people live in fragile settings with weak national capacity to deliver basic healthcare services. Combined with continuous crises that are hitting, this presents a significant challenge to global health. So if you now then look at the current context of the pandemic that we're having, these issues are only getting more aggravated. Now, with that in mind, it's more important than ever that action is taken. And we plead that this action needs to be taken in a coordinated as well as collaborative way in order to make sure that no one is left behind. With that in mind, it is my pleasure to open today's panel, consisting of people taking exactly this action on a daily basis. Now, as we believe that entrepreneurial action can be taken by anyone, it is really, if you think about it, the personal motivation as well as the connection to purpose that creates a special drive. Thinking about that, I would really love to take the opportunity to quickly introduce our different panelists we have on the call, but that actually leave you with that question: what is your why? So why does this topic matter so much to you? And I would love to start by inviting Pradeep to speak to us. And as I mentioned before, Pradeep is part of UNAIDS, and UNAIDS is leading the global effort to end AIDS as a public health threat by 2030 as part of the Sustainable Development Goals. So among other things, Pradeep is leading the Health Innovation Exchange of UNAIDS, and that specifically is working with countries to identify pain points that are faced by ministries of health, and that specifically for delivering healthcare. And with that, he's engaging with global innovation ecosystems to identify appropriate solutions to respond to these. And then he looks for investors to take these to scale. Now, Pradeep, what would you see as your why? Why does the topic of health matter to you?
Flora, thank you very much. I think that's a very interesting question, because for me, I see two critical, I would say, experiences that drive me today. One is probably 30 years ago. I've been working on HIV for about 30 years now. And I started my life as a filmmaker. I was making films and documentaries for television studios. And I was doing this film on HIV in India in 1991. And a very good friend of mine tested positive for HIV while I was filming that film. And at that point of time, the belief was that by year 2000, 1 out of 10 Indians would be infected. His wife got infected. The child that was born to them was infected. And for me, I felt the urge to do something about preventing HIV. So I started some of the early prevention work. So that's what brought me to the AIDS response. And then a couple of years ago, I turned 50 in 2019. And I was sitting next to the Minister of Health of Sierra Leone. And we were chatting before an event. And I said, I've just turned 50. And he said, do you know what? In my country, 51 is the average life expectancy of people. And for me, that was a huge shock, because where I live today in Switzerland, the average life expectancy is 85. 35 years is a huge difference, and that's just not acceptable today, because we have all the technologies, all the resources to make a difference. And I felt really called to see how can you bring these new technologies to have an impact so that people don't have to lose 3.5 decades of their life. So that's what brought me to my current role in really looking at why are these tools not being used to deliver healthcare for people who need to have that.
Thank you very much, Pradeep. With that, I would love to turn to our entrepreneurs in our panel discussion. And I would love to start with Diana from Bive. So Bive is a social business that facilitates access to timely and high quality as well as affordable healthcare services for low-income Colombian farmers. So the focus is really on Colombia. Through a low-cost membership, Bive's users have access to a network of more than 200 private healthcare providers, and they are offering their services, which are faster and of better quality than regular health services. And that at a price that Bive's users can afford, which saves them about 50% of the normal price. So far, they have reached 21,000 beneficiaries, 250 healthcare providers, as well as more than 20,000 healthcare services that have been provided. Diana, tell us a little bit. How did you get into this topic of health, and why did you focus specifically on the Colombian farmers?
Okay, so I was raised in a farmer family, which has given me a deep understanding of the problems that rural population face to access healthcare. In the university, I decided to study business, but I felt something that was growing inside me. because I didn't want to graduate and work in a big corporation creating money for somebody else. I thought I made like a mistake choosing my professional career. But then at the end of my studies, I knew about social businesses, entrepreneurship, and I understood that I can use my business skills and knowledge for a bigger purpose. And I was inspired to build a solution for my grandparents and their communities. And then 8 years ago, like I co-founded Bive, and now we are reaching like 21 farmers, and we have provided more than 20,000 healthcare services. So it's like an example how like an idea can go to the paper to the real world and also like impact a lot of people.
Thank you so much for that. And very interesting to hear about your personal context in that setting. So thank you so much for that. I would love to hand it over to Roberto from Portal Telemedicina and to also quickly introduce to you his company. So Portal Telemedicina is a health tech company. And what they do is they provide reliable, fast, and low-cost diagnostics that empower doctors with AI, automated workflows. So creating interoperability between hundreds of cities nowadays, and that in Brazil as well as in Africa. Portal is active at more than 300 cities already and doing thousands of daily diagnostics. And they have actually been nominated by Startup Nations for the most impactful solution in their first year of the company. Congratulations for that. And to this date, they have raised more than $5 million with R&D cycles, together with many partnerships around the globe. So those are pretty impressive numbers. And Roberto, I have also heard that you are that you are actually in this room, the youngest panelist. So at such a young age, what drove your entrepreneurial action to really get into the topics of health as well as tech?
It was a great mix of things during my life. It's a privilege to be here with so many wise brains sharing my point of view of things. But I'm a co-founder and currently CHRO at Portal Telemedicina. In my background begins really when I was around age of 15 years old. And I worked with many state-of-the-art technologies back then. It was my hobby. And this experience was around machine learning, computer science, information systems, IoT, and I saw so many powerful tools. I worked with drones, I worked with social media, I worked with even seeing technologies running through phones and television, but it was not being used to improve essentials to our lives. And I saw that as a kind of a waste of potential. Same goes for my co-founders. As family as well, we had some past experiences in healthcare. And in order to provide like a better analysis for a doctor, diminishing costs and diminishing travel distance for Brazil, it's such a huge country, we thought of creating Portal that was initially to solve medical distribution around the country, medical specialist distribution, and to help solving the problem for interoperability as well between medical devices, between systems. And today we provide a robust solution usable in many different ways, empowered with AI, in order to provide universal access to quality healthcare. It's a solution that could be used both in underdeveloped countries and developed countries as well. And my motivation is to share this mission, to share this technology to the greater good. I think involving companies, governments, institutions around the world, it's what we are aiming for, and helping lives whatever they are. It doesn't have to be better or worse depending where you are living. We think we could share this technology to everyone around the world.
Thank you so much, Roberto. And it's interesting to see the connection between tech and health, which maybe some of our viewers have also not made, but is yet quite crucial. So last but not least, I would love to introduce to you in more detail Laura from Unima. And Unima is a biotechnology company, and what they do is they develop fast and low-cost diagnostics and a real-time disease surveillance system. So the tests that they're providing are point of care. They're easy to use. They are fast, less than 15 minutes that takes, and they're affordable. So we're talking about $1 to $5 for one test. they have 3 tests that can potentially be in the market in the next 6 months, and another 2 tests that can potentially be in the market in the next 12 months. So to the 2 ones that they have, there is one which is a TB antibody triage test for tuberculosis. And they have registered that in Mexico and have contracts with about 6 million devices for Southeast Asia as well as Latin America. And moreover, quite interesting for the current pandemic context, they have a COVID-19 antibody triage test that they were able to mount onto their platform in about 2 months. And they have already secured contracts for more than 500K devices for Argentina as well as for Indonesia. And I have also read that you have a SARS-CoV-2 antigen saliva test that is currently undergoing validation right now. So that sounds quite technical, but I'm quite sure that there's quite the personal motivation behind that. So Laura, what is your why? What did trigger you to get into this?
Thank you, Flora. It's a pleasure to be here, and thank you for the question. So, a very long time ago, when I was very little, I had a sister, and she lived with disability her whole life, and I lived that very closely with my family, and saw the effects it had, especially on my mother. Fast forward, that had nothing to do with infectious diseases, though. But fast forward, I started working for a pharmaceutical company, and there was this very, very wise man that used to talk about pandemics. He talked about pandemics not only for humans, but also for animals, and how they would come up every now and again. And there was this pandemic in the poultry farms, and there was this pandemic in the swine industry as well, and how that affected. And that got us thinking also a lot about the pandemics that currently are happening in the world. Because not only are the pandemics that we saw in 2003 of SARS and 2009 H1N1, but also we have been seeing pandemics that have been all the time around. These are tuberculosis pandemic, the malaria pandemic, and we know that there has to be a better way to be able to control that so that more people have a better quality of life for a longer period of time. So that's what motivates me personally to go forward with this idea.
Thank you so much. Wow. I don't know what about you, but I find there are quite some impressive solutions here. And you also heard a lot now about the motivation, which can sometimes hit a little bit closer to home than what you would like. So being aware of the fact that hitting close to home, we are currently in a pandemic. Depending on which part of the world you're streaming into, it may actually be strong numbers on the rise, or you may be amidst it, or at the moment it's a little bit better. But wherever you are in the world, we see that action is now important than ever. And Pradeep, as an expert in this sector, we would love to hear a little bit from you to kind of sense what you are seeing right now and what also collectively the sector is learning from the pandemic. So if you could share a little bit your insights that you're seeing, as well as maybe current challenges, as well as what would be important to consider then, given these insights and challenges. The floor is yours.
Thank you, Flora. I think you used a data point. You were talking about 1.6 billion people living in fragile settings. And you know what is highly likely is that COVID has completely changed those numbers, and you'll be seeing a much larger number who are vulnerable. And even a year ago, if somebody had spoken about a little virus changing the way we live and the way we respond to our daily lives, nobody would have taken us seriously. But we have all, as Laura said, we have always known about pandemics, and this pandemic was coming. It's just that it's come at a time and on a proportion that we hadn't imagined. But many of the experts have been talking about such pandemics. But then we really haven't invested in strong and resilient health systems. That's the underlying message that comes through from the COVID pandemic. Now, let's take one step forward. So what do we do about it? We do need to have resilient health systems, but I don't believe that our traditional approaches to health systems and strengthening health systems, is going to have the impact on a scale and speed that we need today. So that is where I believe that we need to have innovations that can make a difference in the speed at which we can deliver healthcare for people who are being left behind and who are most vulnerable. I think in order to do that, I see a few disconnects within the health architecture today, and I'll just address a couple of them. First of all, I've been speaking to several ministers of health and working with them to see what the pain points are, and why many of the solutions that we see in so many other aspects of our life, why they don't get used in the health system for delivering healthcare. Most of them do not have access to information on what are the systems that can make a difference and how they can be deployed. But all of them do want to make a difference. And there's a gap or a disconnect between the innovators, like all the others who are on this panel, and the ministries of health. So how do you bridge that disconnect? How do you make sure? Because all the people who spoke now, the motivation is not profit. You didn't hear one word about profits or making money. It was about making difference. So how can you connect these people who want to make a difference to the people who have pain points? Number one. Number two, the disconnects that I see, and which is where I see the Impact Hub as a very important player in this area, is that if you want to have health impact, many of the solutions that you will need to bring in are probably not within the health domain. And I'll give you two examples. One, if you speak to ministers of health in several countries, at least 50% of their primary health centers, that's the front line where you're providing healthcare, at least half of them don't have access to electricity. And many of the tools that we are talking about, the digital health tools that we are talking, which can help to make the transformation, they are meaningless. And if you look at several countries, this phone that you see, this is your health system, but this cannot be used because you don't have access to electricity. The second thing, you want to fly a drone, it's not within the Ministry of Health, it's with the Ministry of Defense. It's the information tools that Roberto spoke about. How do you use new technology? The culture to adopt new technologies is not there. And I think there is a need for us to see how we can bring about this collaboration. And one last thing is really investments. Despite COVID, if you look at many of the innovators who are small and who really have local solutions, the mechanism is not there. If I want to raise 100 million for one of the innovators who has a solution, easy. Every investor will come and speak to you. But you want to raise $2 million, $1 million, it doesn't even cut the ice. So we need to see how you bridge these disconnects. How do you bring these different people, which is your innovators, your ministries of health, your communities, your investors? How do you bring all of them together to deliver collectively? That's what's going to help us to win the war against the virus, but also to build those resilient health systems.
Thank you so much. And I think there's a lot of truth in what you shared there, and also thanks for sharing then really an international view, speaking to a lot of ministers from different parts of the world. And something that resonates very strongly here is the point you made around needing strong and resilient health systems, and there's quite a disconnect on some different levels, and that impact and speed is something that we very strongly need. So in order to bridge that gap, you mentioned it's important to have the innovators as well as the ministries talking to one another, or any kind of public officials. So maybe with that in mind, let's turn to our entrepreneurs and really hear from you. What does it actually take to scale innovation in healthcare from your specific examples? So what did it take for you, and how are you dealing with it? And Roberto, maybe to start off with you, how does scaling work with Portal Telemedicina? What is your reality there, and what are the key success factors?
I think in our eyes, we always focused a lot of our efforts to create scalable solutions. Since day one, that means not do everything, every single tool, every solution by ourselves. We started by integrating with medical devices, for example. We got all the devices we could, we got all the mentoring we could, and naturally, the manufacturers started to see that our solutions were in a 20-year-old device, for example, and started to refer us to bring customers to us even without any contract affiliations. The same goes for medical insurers. We started to connect 1, 2, 3 clinics on their networks, and they saw our solutions, empowering them, and then they brought us more and more customers. We then started to create more of a base of data, and with this, we started to create cycles of R&D. With past experience from our co-founders that worked with NGOs, for example, here in Brazil, you could create some R&D easily in terms of bringing people to the cause, but not in terms of grants, for example, or in terms of acceleration programs. So we started to create these R&D cycles and getting together with a lot of acceleration programs to validate our technologies. So such as Google Launchpad Accelerator, for example. We went many times to Silicon Valley to test these state-of-the-art technologies, to see how they use these powerful tools in their daily basis in such huge company. And it was amazing to see that this assistance exists. You just have to pursue it. You just have to bring this innovation, this scalable mindset to your daily basis, and then reflect this to these peers that are there just waiting for companies such as us, such as ourselves, to just share this knowledge in so many different ways. We started by bringing papers, for example, from universities and trying to do this in a more of a production side with R&D grants, for example. So we test with this budget that we could get from universities, from foundations, and time to time, we got acceleration programs to just get more of a robust mindset and start to thinking out of Brazil. So Accelerate2030 is the greatest example. We started to understand how to follow these international protocols, these international mindsets, how these strong bonds work with companies, work with institutions out of Brazil. And this enabled us to create kind of an ecosystem of partners, continuously assisting us, continuously us assisting them, and time to time creating new scalable solutions, creating new ways of applying these mindsets. And this is more of a practical way of things, of course. We started on a base of culture as well. So this mission and values, we try to align this with every single person that we work with Portal. And I'm not talking about only employees. I'm talking about entities. I'm talking about companies. I'm talking about governments, everyone that works with us. It's not like an interview, but we try to stick with people that has the same culture, that has the same mindset, that has the same energy. And with this, you could bring this mindset to not disrupt after some time. So we've been around 5 to 6 years now, and our beliefs, our mission, all these things that compose us, they are together in the same cause. Even though we are going to bring this R&D cycle to France, to US, we already have partners that have this same mindset and this same desire to go beyond the limits, to go beyond what is the same old and the same again, not a scalable solution that works maybe in one state, maybe in one country. You want something that could be worked around the globe with the same idea, with the same budget. So I think this covers a little bit of the thing.
Thank you, Roberto. And there's definitely a lot of points shared in there, from culture to investment to cross-bridging to technology. So very interesting. And turning it over to Diana, what would be some of the key success factors that you would say were there for Bive to scale the innovation?
Okay, so I want to mention 2 factors. The first one is collaboration. Basically, Bive's models is based on collaboration. We partnered with healthcare providers to make accessible and affordable their services for low-income communities. We collaborate with partner associations who buy the membership cap for their memberships, for their members, and with the healthcare system to ensure that our users can continue higher complexity care when it is required. As well, we partner with large corporations, NGOs, and universities to ensure funding and implement our social projects that bring closer early diagnosis and health education for rural communities. And the second factor is to see an opportunity in every failure. And here I have a good example. We plan to implement this year a project for prevention of cervical cancer, and due to COVID-19, the project was canceled because it required field work and collaboration with local hospitals. So we identified opportunities to support our communities during the pandemic and reallocate the funding of the previous project in a new one to prevent the infection and promote early detection of COVID-19 in rural communities during the main coffee production season, which is essentially really important for the economic activity for the country and also for the small farmers. With this project, we will reach 24,000 coffee farmer families in 7 regions in Colombia over the next 3 months. So it will be an opportunity to expand our social impact, but also our business model to new regions. So for us, like collaboration and this aspect, or to see an opportunity in every failure, it has been our key factors for continue growing.
Thank you so much, Diana. And as the aspect of collaboration runs very true in the veins of the Impact Hub network, I'm glad to hear that. Handing over to Laura, talking about Unima and your scaling strategy and what you see as main success factors in moving Unima forward.
Okay, thank you, Flora. So yes, for Unima, collaborations have also been very, very important for our growth and our sustained scalability. That's no question about it. Moving it a little bit further, one of our most valuable collaborations that we have had, it's specifically and also with Accelerate 2030, has been the part that doesn't look only at the external players that make your company grow and that can help you get the resources to get to your goal. But also we were mentored into the internal resources in each of us that we have. And this is to talk about your own sustainability. So we cannot speak about sustainable companies or sustainable ideas that you want to implement if a person is not sustainable in itself. You cannot pour from an empty cup. So we need to understand what internal resources we have, how we can harness them, how we can make them grow. So you can be a very integral person in every aspect of your life. The entrepreneurs that make these ideas happen are people that are very forward-looking. But when we forget the person that's making it happen, it can fail at some point, not because the company was going in the wrong direction, but because the entrepreneur cannot take it any longer. So if you are able to see and you are aware of what aspects you are weak or you're strong or you can make better, you will be a very resilient person, a successful person, a person that gives energy to other persons around them and that can lead by example. So that's one of the most important resources that I think we can exploit as entrepreneurs. And we need to look inside ourselves to make things happen as leaders. So that's something that I think we are not as aware in other countries of the world. And I'm so thankful that it has been brought to our attention that we can step up and step forward too. Thank you.
Thank you so much, Laura. And at least by the nods that we can currently see, this is definitely a topic that connects all of us, right, about personal health. And I'm sure that if we were to see the others tuning in today, we would see more nods around the screens around the world. So this is a very, very important topic, especially if you look at numbers that social entrepreneurs do have very high, and generally entrepreneurs very high burnout rates. And thank you for mentioning that and bringing the attention there. Now, we're nearly closing already this wonderful panel. And I think when it comes to looking at, driving innovations in healthcare in Latin America and also beyond, I think we should really close with a clear call to action to really see to anybody who's listening, be it as an entrepreneur, as someone from any ministry, or just an engaged and interested individual. What does it really take to scale promising solutions, and what are the barriers that should be overcome? So what is needed for promising entrepreneurial solutions like yours, and maybe more than on a meta level generally, Pradeep, to reach scale? And let's just go in the same direction. So I'd love to give the word to Roberto. What's the call to action you would make?
I think it goes deeply from the point that Pradeep brought us a couple minutes ago. That is, it should be easier. It should be something that is close to standards. The way that you bring your solution to a country, to a way that could be used in more than one region, and it could be something that it's small or something that is big. It's not easy for companies, to entrepreneurs, to understand which path to follow. With the assistance from Accelerate2030, it got easier to us, but it was years and years until get this international mindset, these international protocols, and how to work. Healthcare, it's kind of super hard when you think about working with different cultures, with different countries. And I think a multilateral healthcare regulation is where we are trying to aim for. Not to create ourselves, but to start to understand like a step-by-step on how we are doing, for example, with R&D cycles. We didn't see any step-by-step, but we try to do ourselves. We try to bring a lot of collaboration, a lot of assistance from foundations, for universities, from anyone that really wants to help. And creating this mindset will probably create a road that others could follow. And I think that it's not up to me, it's up to everyone that wants to take this path.
Thank you so much, Roberto. Diana, what would you say is the call to action you would like to send out there?
As Roberto, I also want to highlight one important aspect that Pradeep said. And for me, one of the key factors that is needed is to scale up evidence-based innovations. So the role of entrepreneurs in any sector is introducing innovation, and especially in the healthcare sector, I think is a key point, because the traditional government structures are not designed for innovation. There are like a lot of fragmentation and multiple like kind of players in the delivery of healthcare, and it obstructs like the innovation processes. So our role as entrepreneurs is to disrupt the status quo and find other ways to increase and improve access to healthcare, reach the last mile, and close the inequality gaps. And here is when the government comes back to the like to the story, because its role is to partner entrepreneurs and scale up evidence-based innovations by introducing them into the health systems. So the world is full of innovations that have proved to work better than the current systems. We are just 3 examples of them, so we need to work together to overthrow the status quo and improve health and well-being for all. So that's my call to action.
Thank you. And that's a very powerful one. Laura, handing it over to you. What will be your call to action when it comes to scaling promising solutions like yourself to reach scale?
So my call to action to stakeholders, and everybody's a stakeholder in health. Everybody has a part to do. So it's to be abundant. And by abundant is that we need to share our resources, be skills, be knowledge, be contacts, be even financial resources, and systematize how we're going to make healthcare solutions be available to all. So nobody has to see their kids be die, or their kids be sick or dying too young. We all have the right to a life that's healthy, and to be able to share all the gifts and talents that we have in a completely abundant. Sorry for the repetition, but really like with total clarity and total fulfillment. So that's what I want to say. This is an invitation. There are many opportunities out there, and we can all chip in. So
thank you so much. Now, last but not least, we have heard from our entrepreneurs, as Diana said, some 3 examples of many more who are out there really building that new future and driving healthcare innovation. Pradeep, from your perspective, what would you say would be the call to action to really scale promising solutions like the 3 ones we've heard of today?
Thank you. I will keep it really brief. 3 real action call for action. 1, there is a need for change of mindset and culture. The way we design health at the global level and at country level, it's like there's no change that has happened over the last 30 years. It still is thinking about it as one solution that will come from one place. But today, the way we have seen is that the solutions are coming from multiple innovators, which needs to come together to deliver healthcare. There is need for changing the culture so that ministries of health are able to adopt those innovations and take those to scale to have impact. So that's 1. Number 2, I think this is a message. If you're a donor listening, take more risks, invest in innovations, because that's where you'll have the maximum impact. If you're an innovator, continue to do what you're doing, and also start connecting across innovations, across sectors, because many of the solutions for health will come from other sectors. And when you start connecting those, it becomes really powerful. If you're an investor, then start making it easy for startups, for innovators, and also particularly women entrepreneurs. I'm really pleased to see at least 2 women entrepreneurs here to invest in that, because that is not happening. There's a very small percentage of resources going to women startups. So how can we really transform that? And one last thing, which I think Roberto touched on, how can we create common health technology assessments so that we have each one of us don't have to go country by country and test and prove that our innovation works? How can we set up at least regional, if not global, health technology assessments that is common? And a salvage fund, because I do see with COVID, there are so many innovations who are struggling to keep afloat. I think if you're an investor, if you're a donor, invest money now so that we can rescue these innovations and keep them afloat for the next 12 to 18 months. They will give you much higher returns than any other investments that you're making. Sorry, that was more than 3, but I'll stop there.
No, that was really wonderful to have some closing remarks actually touching upon different stakeholders within the system. As Laura said, everyone is a stakeholder here. So wherever you're tuning in from, whatever your role is, you know what you need to do. If you need a little bit of support still, there are 2 options we can give you also from our network perspective. So these entrepreneurs have talked about Accelerate2030 supporting them. And we are actually launching the 4th edition in more than 15 countries in 2021. So we would be very happy to welcome you there if you're an entrepreneur, or also if you are an investor, if you're a public official, or if you are anyone from a company working in the sector interested in getting in touch. And lastly, if you're an interested individual just wanting to be connected to other inspiring individuals like these ones on this call, you can join our global community of change makers with global membership that we as Impact Hub Network are currently offering for free, especially in times of the pandemic, as it's important to stay connected. And as the point of collaboration has been actually mentioned more than once in this conversation. So with that, I think there's nothing left to say other than thank you. Really a deep thank you. It was really inspiring listening to you. Thank you, Pradeep. Thank you, Laura. Thank you, Roberto. And thank you, Diana. And please keep up the good work. And I hope you will be joined by many others so that through a collaborative effort, we can actually achieve a future that works for all and leave no one behind. Thank you very much from Accelerate2030 and Impact Hub.
Thank you.